Hey everyone, and welcome. Today we are going to master a skill that you will use constantly in your career, the IV piggyback. We're going to break this down step by step, not just on the technique, but on the why behind every move. It's all about keeping your patients safe. Let's get you ready for the clinical floor.
So why are we focusing so hard on just one procedure? Well, get this. Medication administration can eat up nearly 40% of your time as a nurse. That's a huge chunk of your shift. So getting the IV piggyback right isn't just about passing a skills check off. It's about mastering a massive part of your daily job.
Okay, so what exactly is an IV piggyback? The easiest way to think about it is that it's a smaller bag of medicine, usually an antibiotic or something similar, that kind of piggybacks on the main IV line. It hitches a ride. And the cool part is, thanks to gravity, it runs in first while the main bag pauses. Once it's done, the primary line just kicks back in automatically. It's a really smart, simple system. All right, here's our game plan for today. Think of this as your own virtual clinical simulation. First, we'll cover the high stakes involved. Then we'll dive into the golden rules of safety. After that, we'll walk through the whole procedure, from getting your supplies ready to the actual bedside steps, and finally, what to do after and how to document it all.
First up, let's talk about the stakes. Because you're going to be doing this procedure so often, it can be really easy to get into a routine and maybe get a little complacent. But we have to remember, every single time you hang a piggyback, you are holding a huge responsibility for your patient's well-being.
And really, this slide says it all. Every single check, every step we're about to go over, it's all there for a reason. It's a safety net. The one and only goal is to prevent medication errors and to protect our patient from any potential harm. This is without a doubt the absolute heart of what we do as nurses. Now, let's get into those golden rules. And please, don't think of these as just a list of things to memorize for a test. I want you to see them as your personal toolkit, the gear you'll carry with you on every single shift to keep your patients safe. Okay, before you even grab the medication, these 3 checks are completely non-negotiable. First, allergies. You have to know what your patient is allergic to. Second, you have to verify their identity. We have to be 100% sure we have the right person. And third, infection control. We are tapping into a direct line to their bloodstream, so being clean isn't just nice, it's critical. And this right here, this is the bedrock of safe medication practice. These are the famous rights. Now, there are a few variations, but these 6 are essential. You've got 5 checks you do before you give the med. Right client, right medication, right dose, right route, and right time. The 6th one, right documentation, is what you do afterwards to complete the process. Getting these down isn't just a good idea, it's your duty. All right, safety toolkit in hand, let's start our simulation. What you do before you even walk into that patient's room is just as important as what you do inside. This is where we set ourselves up for a smooth, safe, and successful procedure. So your prep starts at the computer. First, you're going to review the patient's chart. Check that medication administration record, or MAR. Double-check those allergies again, and look at any relevant lab results. Then go get all your stuff. The medication itself, a secondary IV tubing set, alcohol wipes, gloves, the whole shebang. And always, always provide privacy. Close that door or pull the curtain. Now you're ready to head in. First thing you do, hand hygiene. Every time. Then, you're going to identify your patient using at least 2 identifiers, usually asking their name and date of birth and checking it against their wristband. And finally, you talk to them. Let them know what medication you're giving, why they're getting it, and anything they should watch out for. This is so important. Okay, time for the main event. We're at the patient's bedside. This is where all that careful preparation really pays off, and we get to execute this core skill with total precision. You're going to notice we're repeating ourselves here, and that is 100% on purpose. Safety is all about double and triple checking. So one more time, you're going to verify that patient's ID, often by scanning their wristband. Then you scan the medication, checking it against the MAR again. And finally, you use your eyes and hands. Assess that IV site. Does it look puffy, red, or feel cool? You have to make sure that primary line is good to go. Time to get this set up.
First, you hang that piggyback bag higher than the main bag. Simple physics, right? Gravity will make sure the higher bag infuses first. Next, and this is so important, you have to prime the secondary tubing. That just means you run a little fluid through it to get all the air out. You absolutely do not want to push an air bubble into your patient's vein.
Okay, pause. We have given this step its very own slide for a reason. It is that important. You have to vigorously scrub the hub, that little port on the main IV line, with an alcohol wipe. And then you have to let it air dry. Don't fan it, don't blow on it. This simple step is one of the most powerful things you can do to prevent a serious bloodstream infection.
Now let's put it all together. You'll attach your primed secondary tubing to that freshly cleaned Y port, then open up the little clamp on the secondary line, and finally, you'll program the infusion pump. You'll tell it the correct rate and the total volume to be infused, exactly as it was ordered. The pump takes it from there.
So, you've done everything by the book, the pump is humming along, but we all know that things don't always go according to plan. You have to be ready for the unexpected. So the question is, what do you do if something goes wrong? Let's look at two common issues. If you suspect an allergic reaction, maybe they're getting hives or having trouble breathing, your number one move always is to stop the infusion. Then check their vitals and call the provider. Now, for infiltration, where the IV fluid is leaking into the tissue, you also stop the infusion, but then you'll usually take the IV out completely before you call the provider. Knowing these different first moves is key.
The medication is in and your patient is doing well. So we're done, right? Not quite. We've reached our final and super important section, aftercare and documentation. This is how we close the loop and make sure we've provided complete care.
Your documentation has to tell the whole story. It's a legal record, but it's also how we communicate with the rest of the team. So you're going to chart the basics, the date, time, med, dose, and route, but also include your own findings, like how that IV site looked. Make a note that you educated the patient, and critically, document how they responded. And of course, if anything unexpected happened, you document that and every single thing you did about it.
This quote really brings it all home. Remember that sixth right of medication administration? This is it. Good documentation is not just busy work. It ensures the next nurse, the doctor, anyone on the team can look at that chart and know exactly what happened. It is absolutely essential for safe, collaborative patient care.
So there you have it. We've walked through the whole thing, from the prep work all the way to the follow-up. You now know the how, but more importantly, you know the why behind every single step. So the real question isn't just can you remember the steps, it's are you ready to take on that incredible responsibility of ensuring patient safety? Trust me, mastering the IV piggyback is going to be huge for your exams and for your whole career. If this explainer was helpful for you, please do me a favor and hit that like button, subscribe, and share it with your friends in nursing school. And hey, if you're getting ready for the big test, the NCLEX, be sure to check out the links in the description below for our summarized revision guides. Thanks for watching, and I'll see you in the next one.